Thank you. So she will be talking on management of acanthosis nigricans. I would like to ask Rishabh to introduce Dr.
She is
Geeta.
a renowned dermatologist in Ahmedabad.
Hello, everybody. So I have been practicing dermatology since the last 25 years. Thank you, PCOS Society of India, for inviting me here. Today I shall be talking about management of acanthosis nigricans. And acanthosis nigricans is a very overlapped disease where, there's a role of a dermatologist, there's a role of endocrinologist, gynecologist, and, so we all have to walk together and take the patient towards the solution. How do I do this? Okay. So skin, my dermatology, is the mirror of your health. So, this is 25 years back when I went for this, we had these interviews. Now it's very different, but that time, we were like, tamne aam alle che su જોઈએ છે, it was like that, So I have done my UG from Karamsad, and there was no PG that time, so I stood in line at Baroda because there were some extra seats lying. And so although I stood third in my class, I was a beggar. I was, whatever you give me, I'll take. But I was given anesthesia. I said no. Gynec, I said no. The diploma. So everything was no. And then he said, Madam, kuch to lena padega. So I said, okay, I'll take skin. So because I thought that was, that was fine with me. So, and after 25 years, I'm so glad that skin is the mirror of your health. And here I am speaking about it. So our skin reflects changes in the body's internal environment. You can see the skin tags and the acanthosis nigricans, which can tell you that this patient is having metabolic syndrome. Red itchy rash, which means there's some allergy going on. Red butterfly rash, which can tell you about collagen vascular diseases. Yellow tint about the ill liver. And dark unusual moles, which can mean something really nasty. So what is acanthosis nigricans? I'm sure the speakers before me would have told you, but let's go through it quickly. It's a skin condition characterized by velvety papillomatous overgrowth of the epidermis and hyperpigmentation and hyperkeratosis of the skin, usually occurring in the flexural area, especially the underarms, the groins, inframammary regions, and the neck. And we as dermats see a lot of it coming across to us on the face. So these are a few pictures depicting how acanthosis nigricans appears. And these are a few pictures of my patients who've come to me in my clinic, undiagnosed with acanthosis nigricans. So what are the causative factors for acanthosis nigricans and the pathophysiology? Let's go through it quickly. So there's insulin resistance and hyperinsulinemia. So the body's tissues become less responsive to insulin. The pancreas compensate by producing more insulin. There's elevated levels of insulin, and insulin is a potent growth factor. Let us not forget that. That can stimulate the epidermal growth factor receptor and insulin-like growth factor receptor, which acts on the keratinoids and fibroblasts in the skin. So this promotes further proliferation of keratinocytes and fibroblasts, leading to characteristic thickened, darkened skin seen in acanthosis nigricans. So as Dr. Bansri talked about adipokines, so there it is, and the hormonal imbalances. So patient with PCOS that are obese, they further exacerbate insulin resistance. The adipocytes, they secrete leptin, which is a hormone that enhances insulin resistance and promotes the secretion of insulin. And higher level of leptin in PCOS may directly contribute to the development of acanthosis nigricans. So there is also melanin overproduction and hyperpigmentation, which leads to the development and what is visibly seen as acanthosis nigricans. There are inflammatory mediators which are released by the adipose tissue, which exacerbates the epidermal hyperplasia and overall skin thickening. So what is the relation between acanthosis nigricans and insulin resistance? So we can see in this chart depicting the insulin resistance, which gives rise to hyperinsulinemia, the release of these growth factors, hence giving us visibly acanthosis nigricans. So I'm sure we have gone through this before, so we'll skip this slide. There are all types of acanthosis nigricans, and there is a methodology and evaluation and approach to treat and to diagnose and to find out what is the cause leading to acanthosis nigricans, but I'll stick to my talk. Okay, so there's this scale which grades acanthosis nigricans depending on the area which is affected by it. Let's see what it is for neck. So for neck, 0 is absent, which is not detectable on close inspection. 1 would be present, but on very close visual inspection. Grade 2 is mild. Grade 3 is moderate, which extends to the lateral margins of the neck. And grade 4 is severe. It is visible even when you see the patient from the front. Hence, and also similarly it is for axilla. So 0, 1, 2, 3, 4. This is how we grade the acanthosis nigricans dermatologically. So there's another grading for the neck texture, which is 0, 1, 2, 3, depending on the roughness in the texture. Similarly, on the knuckles, elbows and knees, we just mention it whether it is present or absent. So how do we manage? So when we see the skin lesions, typical resembling acanthosis nigricans, as we all know, that's clinically assessed. So we look at other sites of hyperpigmentation. If it is atypical sites, you seek the dermatologic opinion. If it is generalized, rapidly spreading, rapidly developing, or rapidly progressing with mucosal involvement associated with weight loss, you investigate or refer him to an oncologist. If there's menstrual irregularities, you investigate for hyperandrogenism, of course refer to gynec and endocrino. Look for features of IR and look for features of metabolic syndrome. If there are features of hyperandrogenism, you have to do all the investigation and better still refer to the experts. So how do we manage acanthosis nigricans and associated conditions? If it is cutaneous, we try the topical therapy first. We'll go to what that is. Then there's systemic therapy. There's procedural therapy like chemical peels, cryotherapy, lasers. If it is just conditions associated with acanthosis nigricans like diabetes, PCOS, metabolic syndrome, drug-induced malignancy, you refer to the allied experts. Definitely take some time out always to talk about lifestyle management. That's what we do in our clinic. Even if it is just grade 1, you have a lot of scope to transform that patient's life by just about talking about lifestyle management. So that includes exercise, diet, sleep. And what I do is every time the patient comes to me for consultation, whether it is his first time or his 10th time, I never fail to take out 10 minutes and again reiterate the same things. So again, it goes for education and counseling and also management for stress, anxiety of patient and the family. Coming to what is lifestyle modifications, which I think forms the baseline of the management. The diet, obesity is an important contributor to insulin resistance, PCOS, diabetes mellitus, metabolic syndrome, and other endocrinological disorders. So limiting the consumption of the processed foods, which the Gen Z is exposed to so much, decreasing refined grains, sugars, and foods high in sodium, which comes in all kinds of packaged foods, and trans fats would help in weight loss. Exercise is a crucial lifestyle management tool for weight loss and weight maintenance. It leads to significant fat loss, including visceral fat loss, and improves the insulin sensitivity. Sleep. I cannot stress the importance of good sleep and sleeping at the right time. Poor sleep is known to increase insulin resistance and elevates the diabetes risk through multiple pathways. Distortion of metabolic pathways alters the glucose metabolism, resulting in insulin resistance and obesity. Mental and psychological health. So low self-esteem scores have been reported in adolescent obese girls with acanthosis nigricans, especially with high insulin and testosterone levels. Behavioral approaches in terms of diet, sleeping habits, engaging in physical activities, and reducing stress yield positive outcomes. Coming to the treatment, first is a topical therapy. So what we do in our OPD is we give retinoids to apply. It can be tretinoin 0.1 to 0.05%. What it does, the mechanism of action is it alters the epidermal turnover and epidermal keratinization. The duration can go on to many weeks. There is a risk of relapse on stopping the treatment and can be combined with other topical modalities like ammonium lactate, hydroquinone, fluorocinol, etc. Topical vitamin D analogues, which is calcipotriol 0.005%, how it works is it inhibits the keratinocyte proliferation and promotes differentiation by increasing keratinocyte intracellular calcium and cyclic GMP levels. It reduces the number of keratinocytes, so that's why it may minimize the cutaneous effects of insulin. We also give topical urea, which acts as a mild exfoliant by breaking down the protein bonds between the dead skin cells, helps to shed the thickened and hyperkeratotic skin, which is often seen in acanthosis nigricans. This can reduce the appearance of thickened patches and improve the skin texture. Urea-based creams should be applied directly to the affected area, and this is available in concentrations ranging from 10 to 40%. Lactic acid, which is considered as a gentler alpha hydroxy acid compared to others, better tolerated in sensitive skin, and it is found in concentrations from 5 to 15%. Glycolic acid can be given as an at-home preparation, and we also do glycolic acid peels, which I'll be talking to you about. This is one of the very popular creams that we use. So this contains a combination of urea, salicylic acid and retinol. So what I mean to say is we can give all together. These are all keratolytic and they exfoliate the thickened skin and promote the cell turnover, and added with lightening agents like hydroquinone can help to reduce the hyperpigmentation. Other topical treatments can be salicylic and this triple combination cream, which has tretinoin, hydroquinone and fluorocinol. Coming to the systemic therapy. So of course, there's no, I cannot tell you the importance of oral hypoglycemic agents. I'm sure all of you have gone through it. This is the star over here, metformin, and the next is the rosiglitazone. So this increases the peripheral insulin responsiveness, resulting in reduction of glucose production, reduces hyperinsulinemia, body weight, fat mass, and can be combined with others. But this, we usually in my clinic, we always collaborate with an endocrinologist and then start. Antioxidants like alpha lipoic acid have been shown to be very helpful at the dosage of 400 mg per day, which is a potent biological antioxidant and enhances the insulin sensitivity. Oral retinoids can be given in extensive acanthosis nigricans. So these are isotretinoin and acitretin, and they act by normalizing the epidermal growth and differentiation, and extensive acanthosis nigricans has been successfully treated with isotretinoin. Procedural treatments, which means that what we do in our clinic, these are first of all chemical peels. We use TCA 15%. So these are chemical exfoliating agents that remove the hyperkeratosis and also repair and rejuvenate, acts by precipitation of proteins in the epidermal cells, safe, easy and effective. The other peel that we routinely do is a glycolic acid, and how it works is by exfoliation, skin renewal and enhanced absorption. Salicylic acid peel, again a keratolytic agent, and helps in desquamation of stratum corneum. And of course, these are all to be done with the lifestyle management, with the other drugs. Everything goes together. One thing does not work. One of the very popular peels that we do in my clinic is a Cosmelan peel. It's a worldwide popular peel for very extensive. I'll show you the pre and post pictures of one of my patients on whom we have done. It contains azelaic acid, phytic acid, ascorbic acid, kojic acid, and TCA. So it helps in depigmentation and exfoliation. Cryotherapy is done in some clinics. Laser therapy, like the fractional CO2 laser therapy, is done. So it destroys the acanthotic lesions without damaging the surrounding tissues. Other lasers that are done can be erbium laser and so on. So the newer approach that our clinic has been following is we do skin booster, especially for facial acanthosis nigricans. The key ingredient in this is hyaluronic acid, which is main component in most skin boosters, and it provides deep hydration to the skin, improves the texture, and reduces the appearance of thickened or dry areas. Some of the other skin boosters also contain amino acids, vitamins, peptides, and trace elements. So how they work is they hydrate the skin and they stimulate collagen production. So they improve skin texture and elasticity, which helps to smoothen out the thickened velvety patches associated with acanthosis nigricans. Yeah, so this is another skin booster that we've been doing. It targets the dryness and rough texture and promotes collagen remodeling. So here are a few of the pre and post pictures treated in my clinic with various modalities. Please don't take pictures. This is one patient. Yeah, this is just, I'll just take a minute more. This is a patient, a male patient with acanthosis nigricans and insulin resistance, whom we did refer to an endocrinologist, but for months he, we didn't see any clearance of the acanthosis nigricans, and we've done lots and lots of peels, and he's looking much better because he had very, very thick acanthosis nigricans, especially on the forehead. He's still coming, but he's a lot happier, and he had stopped socializing. These patients, they become introvert, they become depressed, and there's so much of things going on in their life. So this is, now he's happy, he's come smiling to the clinic, and I think that's what I like. So as you see, he's looking much better. And this is the patient on whom we had done Cosmelan. Cosmelan is an expensive peel, so I cannot prescribe it to each and every patient. But for her, we tried all kinds of Q-switch lasers and peels. But since she wasn't recovering, we suggested her to do the Cosmelan. And oh my God, isn't she looking beautiful? Okay, and this patient, he had a very bad lifestyle, and hence the acanthosis nigricans. He recovered most of it, through lifestyle management. Still, you can see there is still ample amount of weight that he's carrying, but he was very worried about this forehead acanthosis nigricans, for which we treated him with skin booster. So you can see a lot of disappearance of this the acanthosis nigricans. This patient had a lot of pigmentation and acanthosis nigricans on the neck, and we have done a lot of lasers, peels, and skin boosters. Although it's still there, but it's she's a lot happier and she looks a lot better. So these are the pre and post. We can see full face and the neck. And this is in the underarms, where we have treated the patient with skin boosters. Of course, this is an ongoing treatment. And another picture of, just with lifestyle management. This is just lifestyle management, and you can see a lot of pigmentation clearing, especially in the under eye area. And yeah, here also there's a lot of facial acanthosis with just lifestyle management and just topicals to be applied at home. Thank you so much for patient listening.
Thank you, Geeta, for a wonderful presentation. You said 25. I was a little bit shocked. You look so young.
Yes, I'm in my 25th year.
Yeah. It's a wonderful lecture, and you showed the management. Just one question, then Insta, everywhere the skin lightening and all the treatments are going on. What is your say on it? What do you say about it? You do the skin light, the Insta and social media, there are so many things coming about skin lightening. Yes. And this and that.
Yes, so very good question, ma'am. So we as dermatology fraternity are against the word fairness and skin lightening. We believe in skin health. And there has been an era where there was a lot of focus on skin fairness and lightening, but we are now making all efforts to get into that, that era of good skin health, which is not color dependent. But our country is very fairness obsessed. So I think it will take some years for us to make the public realize that good skin is not about color. It's about so many other factors. It's about hydration and glow, irrespective of the skin of color. And India is definitely a skin of color. So why should we, we should be proud of our color. It protects us against so many diseases, actually.
Thank you, Dr. Geeta.